Good evening, everyone. Welcome back to another live session of our 90 Days University Prof Pre-Final Mastery. Okay, so today we are going to discuss about our next topic of discussion, that is diseases of cornea. So today we'll discuss topics like 2 long essays and 6 short essays. And in the long essays, we'll discuss hypopyon corneal ulcer. And the second, we'll discuss fungal keratitis or the corneal ulcer or keratomycosis, you can say. In the short essays, we are going to discuss about deep keratitis, its causes, interstitial keratitis. We are going to discuss about keratoplasty. We are going to discuss about the layers of cornea, corneal scars, exposure keratitis, and the Murin's ulcer. So these are the topics that we're going to discuss, and these topics have repeatedly been asked in your uh, previous year questions and in your university exams. So before starting our today's session, I'd like to give you a brief introduction of what is Auricle and why you should choose Auricle. So here at Auricle, we have recorded classes, we have live classes, we have practical sessions, we have exam modules, and we have hard copy books set. In the recorded classes, we have the recorded lectures, which can be watched by you at your time, at your convenience, and it brings over 10 years of experience on the table by the educators, and it provides you a in-depth knowledge tailored specifically for your MBBS Prof exams in India and FMG, and this also gives you a convenient revision such that you watch these videos at your convenient time so that you should be able to revise it properly. Okay, and we have live classes. In the live classes like this, we have all the important topics discussed with special emphasis on the past 10 years previous year questions and the most anticipated question that can come in this year. And we have in-depth coverage of all the important topics that is provided to you in the live classes. And it also provides you interactive learning with live doubt clearance and with MCQ polls in which you can participate, and Viva works and many more things. Okay, and this express exam module is basically the rapid revision exam module in which you can revise your entire syllabus just before the exam in under 20 hours. And it also provides you the answer writing skills such that you know how to frame your answers when you get a question in your exams, right? And this express exam module also is made for you to get your high scores, okay, in your exams. Okay, we also have one-to-one doubt clearing session, which is made in a very student-centric approach, and the personalized attention is given to the students for clearing their doubts. Okay, and it also helps us to create a safe learning environment. Lastly, we have the hard copy note set. This hard copy note set is made for you in a very crisp and concise manner, and it includes all the important topics and all the important questions that has been asked and that could come in your exam in a point-wise manner and in a beautifully written way, such that you remember the points. Okay, and it is very colorful, and it also includes diagrams which you can draw in your exam. We also have question bank for you to practice, because after reading the topic, it's better to get tested. Okay, otherwise you won't you will be in a delusion like you have studied so much and you have you know everything, but while solving the question, you might miss out few things, or you might don't recall what you have studied. So it's best to assess yourself to this question bank, and this question bank, it has 3 levels from beginner to expert level, and it covers the MCQs for your Prof exams, for your NEET PG exams, and also for your FMG exams. Lastly, we have the practical sessions, because practical exams carry as much as weightage as your theory exams. And these practical sessions are designed to provide hands-on experience and in-depth covering, in-depth understanding of your MBBS practicals. And it also tells you about all the things, that all the instruments, all the X-rays, or whatever that is asked in the practical exams, right? All the specimens, it will be explained to you, and it will also be guided to how to answer your Viva questions, okay, with confidence and skills. Okay, so this was about the Auricle, and we also have our four kind of subscription plans. There's foundation plan, advanced learning plan, complete learning plan, and ultimate MBBS plans. So these varies according to their validity, like 3 months, 6 months, 12 months, and 4 years. That is throughout your MBBS journey. Okay, so you can opt for any of these plans according to your need. And if you want Auricle to be with you for the whole for your whole journey, for the complete from first year to your fourth year, then you can offer the ultimate MBBS plan. It will give you access to everything and for every year. Okay, so this was about the subscription plans. And if you want to opt for any of these plans, you can use the coupon code Dr. Raj Vaghani 20 for additional discount, for additional 20% discount on this price. Okay, so we'll start today's lecture, right? Okay, so our today's topic of discussion is diseases of cornea. So first of all, we'll discuss what are the organisms. Okay, what are the organisms that penetrate intact corneal epithelium? Okay, so what are the organisms that penetrate the intact corneal epithelium? So we know that the our cornea is the outermost layer of our eye. Okay, the cornea is the outermost layer. So this is the cornea, right? This is the cornea. So this is the cornea. So any organisms can enter our eye through this cornea, right? If an organism is able to penetrate this corneal layer, that means it will lead to the corneal disease. Okay. Now, what are the examples that what are the examples of the organisms that can penetrate the intact corneal epithelium? Okay. So the examples include the Neisseria gonorrhoeae, Corynebacterium diphtheria, and Listeria monocytogenes. Okay. Listeria monocytogenes, Neisseria gonorrhoeae, Corynebacterium diphtheria. So these are the three examples of organisms that can penetrate inside the intact corneal epithelium. Okay, it can penetrate into the cornea and can lead to the corneal disease. So what is the main focus topic that we are going to discuss? Sorry, what is the main reason behind that these organisms that we are studying? So these organisms, after penetrating the intact corneal epithelium, they lead to a disease known as hypopyon corneal ulcer. Okay, they form hypopyon corneal ulcer. I will tell you the meaning of hypopyon in the next slide, but just remember this name, hypopyon corneal ulcer. So it leads to the formation of a corneal ulcer, and we'll discuss the etiopathogenesis, the clinical features, the investigations, complications, and management of this disease, that is hypopyon corneal ulcer. So that is a main topic, and it is a long answer question. Okay, it is a long answer question, and if the question comes of hypopyon corneal ulcer, and you know that you have to write your answers under etiopathogenesis, clinical features, investigation, complications, management, you know all these things. But just to gain extra marks, or just to create a good impression of the examiner, always write these things that I've mentioned over here: the organisms that penetrate intact corneal epithelium, right? So don't forget to write these three organisms. Okay, these are the very important organisms if you're writing an answer about the hypopyon corneal ulcer. Okay, now hypopyon corneal ulcer etiopathogenesis. So we are going to discuss the etiopathogenesis. So first point, before starting any disease in detail, we just study the definition. So it is a corneal ulcer with accumulation of pus. So hypopyon means pus. So corneal ulcer with accumulation of pus in the anterior chamber, right? The pus is collected in the anterior chamber. We'll see in the diagram in the next slide. How does this look? Okay, just let us see it at the first. Okay, so just seeing this diagram, I will highlight it this. So there is a pus formation in the anterior chamber. And why it down? Because of the gravity, right? The pus is formed in the anterior chamber throughout cornea. Throughout the anterior chamber, the pus is formed, but the pus has been deposited only in the bottom side just because of this gravity. Okay, there's no reason why it is deposited in the downside, but only reason is the gravity. Okay, so now etiopathogenesis. So the causative agent that caused this hypopyon corneal ulcer is mainly Streptococcus pneumoniae and Pseudomonas. So the main organisms that cause this is Streptococcus pneumoniae and Pseudomonas. Okay, I've told you these three organisms that can enter into the intact epithelium. Okay, like Neisseria gonorrhoeae, Corynebacterium diphtheria, and Listeria monocytogenes. But These can also lead to the hypopyon corneal ulcer, but these alone cannot lead to the hypopyon corneal ulcer. Instead, it will make the eyes susceptible to the hypopyon corneal ulcer. And the main bacteria that cause the hypopyon corneal ulcer is Streptococcus pneumoniae and Pseudomonas, right? So just remember this. Okay. Now pathogenesis. So the bacterial entry due to the trauma or predisposing conditions. Okay, so there may be any trauma or any predisposing conditions through which these organisms can easily enter into the cornea and can lead to the corneal ulcer. Okay, there can also be the intense inflammatory response due to any diseases like if you're having any keratitis, or keratitis means inflammation of the cornea. So if you're having any keratitis, that means the cornea has been inflamed, and in response to that inflammation, in response to the inflammation, there can be the formation of pus in the anterior chamber. Okay, in response to that inflammation, there can be pus in the anterior chamber, which will be called as hypopyon. Hypopyon, right? Okay. So we've discussed pathogenesis. It includes bacteria entry due to the trauma or predisposing conditions, intense inflammatory response, that is pus in the anterior chamber, right? And the risk factors include trauma, contact lens use, and immunosuppression. Okay, so if there's any trauma in the eye, that will generate inflammatory reaction, and that will form the pus in the anterior chamber. If you're using contact lens for a long period of time, for chronic period of time, then you can be susceptible to the development of hypopyon corneal ulcer, because these bacteria, that is Streptococcus pneumoniae or Pseudomonas, they enter the lens very fastly if you use the contact lens very frequently. Okay, and if there's immunosuppression, that is your immune system is not working properly, then also you can develop this disease. Okay, so we have discussed definition. It is accumulation of pus in the anterior chamber. Causative agent, we have discussed two organisms, that is the Streptococcus pneumoniae and Pseudomonas. Pathogenesis, we have discussed 2 points. Bacterial entry due to trauma or predisposing conditions, and it is due to the intense inflammatory response leading which there can be pus formation in the anterior chamber. Okay, and risk factors include trauma, contact lens use, and immunosuppression. Now the clinical features. Okay, so the clinical features include symptoms and signs. What are the symptoms and what are the signs? So symptoms, first of all, include severe eye pain. Okay, there can be severe eye pain in which eye the hypopyon is there. Redness and tearing can be there. There can be blurred vision because the anterior segment is filled with the pus, so the light cannot be entered properly through the cornea. Okay, and the fourth is sensitivity to the light. This is photophobia. Okay, you become increased sensitive to the light, and you do not want to go outside and see the bright light. Okay, so there can be severe eye pain, there can be redness or tearing, there can be blurred vision, and there can be sensitivity to the light. Okay, so these are the 4 symptoms that you can experience in hypopyon corneal ulcer, right? And in signs, okay, what are the signs of hypopyon corneal ulcer? So there can be dense infiltration in the cornea. Okay, in the cornea there can be dense infiltration. That means the hypopyon has become is present since long time, and it is becoming more dense and dense day by day. Okay, as it gets chronic, the accumulation becomes very dense. Okay, second is hypopyon, visible pus in the anterior chamber. Third is the corneal edema and haziness. So these are the 3 signs that you can see in the hypopyon corneal ulcer. Dense infiltration in the cornea. Second is hypopyon. Third is the corneal edema and haziness. Okay. Now, what are the investigations that you would perform in hypopyon corneal ulcer? Corneal scraping. Okay, corneal scraping and other investigations. So in corneal scraping, gram staining to identify bacterial organisms, culture to determine causative agent and antibiotic sensitivity, uh, gram staining to identify the bacterial organisms, and the culture to determine the causative agent and antibiotic sensitivity. And other investigations will include PCR for resistant organisms and slit lamp examination for most of the diseases. Okay, slit lamp, like most of the diseases, slit lamp is also performed to visualize the cornea and to visualize the anterior chamber clearly. Okay, for detailed corneal assessment. Okay, and the corneal scraping means we just take you can say a layer of cornea, okay, and we send it for the gram staining. Okay, and in the gram staining, we can identify the bacterial organisms, whichever the bacteria is present. Okay, and we can also culture the corneal scraping to determine the causative agent and to determine which antibiotic is best suited for that bacteria or that organism, because many bacteria are resistant to uh, antibiotics, some of the antibiotics, okay. And other investigations would include PCR reaction or slit lamp examination. So basically, the corneal scrapping is most common. Second is a PCR reaction, and sorry, second is a culture sensitivity. Third is the PCR, and fourth is the slit lamp examinations. So these are the examination, or these are the investigations that you have to perform in hypopine corneal ulcer patients. Okay. Now, what are the complications and management of this disease? So the complication will include corneal perforation, with corneal perforation, and second, permanent scarring and vision loss. Permanent scarring and vision loss and corneal perforation. So these are the two complications that you could face after developing hypopine corneal ulcer. Okay, the cornea can perforate and the pus can come out of your cornea. Okay, there can be permanent scarring in your cornea even after the pus has been drained. There can be permanent scar in your cornea, and if the pus is present since a very long time, it is chronically present, and you are ignoring the pus in the cornea, okay, then it may lead to the vision loss permanently. Okay, so how do you manage these conditions? Since this is a hypopine corneal ulcer, it is a bacterial disease. Okay, it is a bacterial disease. So most importantly, you have to give the antibiotics. Okay, and in antibiotics, it includes intensive topical antibiotics, which is the fortified cefazolin tobramycin. So these are the two very important antibiotics that you have to remember in hypopine corneal ulcer. That is fortified cefazolin and tobramycin. Okay, fortified cefazolin and tobramycin. These are the two most important topical antibiotics used for hypopine corneal ulcer. Okay. Second is systemic antibiotics in severe cases. Okay, and if there's severe case, you have to give systemic antibiotics. Surgical intervention if perforation or severe thinning occurs. Severe thinning of what? Of cornea. If there's severe thinning of cornea, or if there's perforation of the cornea, that means you have to surgically intervene and you have to surgically repair the cornea. And if the pus is uh, quite a lot, or if the pus is a large in amount, so you have to give systemic antibiotics. Otherwise, topical antibiotics would also work, like fortified cefazolin or tobramycin. Now, the second topic that we are going to discuss is fungal keratitis. Okay, fungal keratitis. So we are going to discuss the etiology of the fungal keratitis. So the common fungi that causes this fungal keratitis is Aspergillus, Fusarium, and Candida. Okay, Aspergillus, Fusarium, and Candida. These are the three most important fungus that causes the fungal keratitis. Okay, and it's also keratomycosis. Anything that ends with the mycosis. Okay. Anything that ends with the mycosis, that means it is fungal. It is fungal. Okay. Anything that ends with mycosis means that is fungal. Also, fungal keratitis means that uh, keratitis or the inflammation of the cornea due to fungus. Okay. So the common fungi that causes this disease is Aspergillus, Fusarium, and Candida. And risk factors include trauma with the plant material, because fungus is most commonly found in the plants only. So if you have any trauma with the plant material, contact lens used in humid environments. Okay, if you're using any contact lens in humid environments, because it is a favorable environment, because it is a favorable environment for fungus to grow. Because it is favorable environment to fungus to grow. That's why if you're using the contact lens in very humid environment, then what will happen, if whenever you are using contact lens, you're making your cornea susceptible to the organisms. Okay, and if you're using it in humid environment, so in humid environments, mostly fungus is present more than the bacteria, and fungus has the more chance of penetrating into your cornea or causing fungal keratitis. Okay, so in humid environment, especially, the fungal keratitis occurs. Otherwise, normal keratitis, bacterial keratitis occurs. Okay, and an immunocompromised state. Okay, these are the risk factors: trauma with the plant material, Okay, trauma with the plant material. Second, contact lens in humid environments. Third is immunocompromised state. Okay, now what is the predisposing conditions? So predisposing conditions include diabetes, prolonged corticosteroid use. Okay, diabetes and prolonged corticosteroid use. Because if you're using prolonged corticosteroids, that means you are decreasing your immune system. You are decreasing your immune system, or you are making yourself immunosuppressed. Immunosuppressed. You're making yourself immunosuppressed. So if you're immunosuppressed, that means the fungus can easily cause the fungal keratitis. And in diabetes also, this fungal keratitis can happen. Okay. What are the clinical features of the fungal keratitis? So it includes symptoms and signs. So in symptoms, same as any kind of inflammation like eye pain and redness. Second is a foreign body sensation. And third is a sensitivity to the light. That is photophobia. Okay, this is photophobia. So symptoms will include eye pain, redness, foreign body sensation, and sensitivity to the light or photophobia. Now, the signs would include grayish-white ulcer with feathery edges. Grayish-white ulcer with feathery edges. It is like this. Okay, I'm just drawing a rough diagram like this. Okay, so it has a feathery edges. You just have to draw it with white. But if I draw it with white, then it will all appear white. Okay, so I'm drawing it with yellow. Okay, so these are the feathery appearance of the feathery edges of the ulcer. Okay, so it is a grayish white ulcer with feathery edges. There's a satellite lesion along the main ulcer. So there's a satellite lesion. Satellite lesion means apart from the ulcer. So this is the main ulcer. Okay, this is the main ulcer, and this is the satellite lesions. Okay, these are the satellite lesions. This is the main ulcer. And possible hypopyon and severe infection. So if there's severe infections, there can be hypopyon. Hypopyon, we have discussed it earlier. That is the accumulation of the pus in the uh, anterior chamber. Okay, and in the bottom part because of the gravity. So we have seen the signs, we have seen the symptoms, and now we are moving towards the fungal keratitis management. Okay, so since it's a fungal keratitis, it is caused by a fungus, so you have to give antifungal therapy. Okay, so first of all, we are just going to discuss about the antifungal therapy. It includes topical antifungals like netamycin and amphotericin B, very important two drugs for antifungals. Very important two drugs for antifungals. Okay, so these are netamycin and amphotericin B. Netamycin and amphotericin B, these are the two very important drugs. Okay, and you can also give oral antifungals in deep or severe cases. Okay, now surgically intervention you have to do when debridement is necessary to enhance the drug penetration. Okay, for example, your eyes is severely injured. So if you want to give the eye drop, you have to make sure that the eye drop is penetrated deep inside the eyes. Okay. And if it is not penetrated, the drug will not work. So to enhance deep penetration, debridement is done. There is a surgical thing and therapeutic keratoplasty for non-healing ulcers. Okay. You can also do therapeutic keratoplasty for non-healing ulcers. So non-healing ulcers include ulcer causes. Just wait for 1 minute. Okay, so I was talking about the fungal keratitis management. So we have discussed antifungals. Okay, so antifungals will include two important drugs I've told you, that is netamycin and amphotericin B, and the oral antifungals in deep or severe cases. Oral antifungals in deep or severe cases, right? So the surgical intervention includes debridement to enhance the drug penetration and therapeutic keratoplasty for non-healing ulcers. Okay, and the non-healing ulcers, non-healing corneal ulcers causes. This is a very important question. Okay, this is a separate 2 marks question. Only the causes will be asked to you for the non-healing corneal ulcers. Okay, so incorrect initial diagnosis is the one cause. Okay, next infections, bacterial and fungal. poor patient compliance with medication. So these are the three very important non-healing corneal ulcer causes: incorrect initial diagnosis, mixed infections, bacterial and fungal, and poor patient compliance with the medication. Okay, so these causes can lead to the corneal ulcer to non-healing. Otherwise, the corneal ulcers heal commonly, but if it is non-healing, then these can be the causes for that. Okay. So the antifungal therapy and surgical intervention is the mainstay of management for fungal keratitis. Not deep keratitis. What is deep keratitis and what its causes? Okay, so deep keratitis means it is penetrating deep into the cornea. Okay, deep keratitis means that it is penetrating deep into the cornea, and it has the three causes. This is infectious disease. Second is autoimmune disease, and third is the others. Okay, so the infectious causes will include the viral causes like herpes simplex virus, and bacterial causes will include syphilis. Okay, uh, so herpes simplex virus, and in the bacterial syphilis, this is caused by trypanoma pallidum. Okay, syphilis is caused by trypanoma pallidum. So syphilis is caused by trypanoma pallidum, and viral example includes the herpes simplex. So these three bacteria and virus, these two bacteria and virus can cause deep keratitis, and autoimmune disease include sarcoidosis and rheumatoid arthritis. Okay, sarcoidosis and rheumatoid arthritis. And trauma and systemic disease can also lead to the deep keratitis. So only the causes, just remember the causes of this deep keratitis. It is not very important, but still the causes can be asked for deep keratitis. That's why I've mentioned it in a different slide. Okay. Now the main, another important question, that is interstitial keratitis. Okay, so what are the interstitial, what are the stages, what are the clinical features, and what are the management of the interstitial keratitis? These are the questions that is mainly asked in your exams. Okay, so we are going to discuss only about these topics. So stages. So what are the stages? First is the active stage, second is the healed stage. So in the active stage, there is an inflammation with stromal infiltration and this corneal scarring with the opacification. So there is a layer of stroma in the cornea. We are going to discuss about the layers of cornea also in the upcoming slides. Okay, so there's layers of cornea. So there is the stromal infiltration. That means the bacteria or the inflammatory substances is infiltrated in the stroma layer of the cornea, and that is the active stage. Okay, and in the healed stage, the corneal scarring is present with the opacification. Okay, in the healed stage, there is a corneal scarring with opacification. Now, what are the clinical features? So the clinical features include pain, photophobia, tearing, deep stromal opacities, and vascularization. Okay, pain, photophobia, tearing, deep stromal opacities, and vascularization. Now, management part. So management part includes topical corticosteroids, antivirals, okay, and systemic treatment. So uh, there is you can give topical corticosteroids, okay, to reduce the inflammation, and you can give antivirals for herpes related cases. If your interstitial keratitis is due to any virus, so you can give antivirals, and systemic treatment for autoimmune related interstitial keratitis. If your interstitial keratitis is autoimmune related, then you have to give systemic treatment, or you have to give systemic drugs like systemic corticosteroids for your interstitial keratitis. And if your interstitial keratitis is caused by any virus like herpes simplex virus, then you can give antivirals. And if there is normal just inflammation, you have to give topical corticosteroids. It will also help to reduce the interstitial keratitis. Okay. Clinical features I've told you: pain, photophobia, and tearing of the eyes with deep stromal opacities, because interstitial means trauma. Okay. Interstitial means trauma. So this is the keratitis means interstitial keratitis means the inflammation happening in the stromal layer of the cornea. Okay, so there can be deep stromal opacities, and there can be vascularization. That means new blood vessel is formed in the stroma. New blood vessel is formed in the stroma due to the inflammatory response. Okay, so that was about the interstitial keratitis. Now, what is keratoplasty? What are its types, indications, and contraindications? Okay, types, indications, and contraindications. So keratoplasty, that means you are keratoplasty is a procedure in which you are performing keratoplasty. That means you are giving a new cornea to the patient. Okay, you're giving a new cornea to the patient. So for example, it can be penetrating or it can be lamellar. Okay, sorry, keratoplasty means harvesting the cornea. That is, you are taking out the cornea from the um, patient. Okay, so it can be penetrating or it can be lamellar. Okay, penetrating or lamellar. Penetrating means full thickness and lamellar means partial thickness. These are the types of keratoplasty. It's very important. Okay, it's very important. That is types of keratoplasty: penetrating or full thickness, lamellar or partial thickness. Now the indications for penetrating keratoplasty. First is severe corneal scarring. Second is keratoconus. Third is failed previous graft. Severe corneal scarring, keratoconus, and failed previous graft. So if the cornea has been severely scarred due to any other cause like hypopyon, okay, then you can go for penetrating keratoplasty. If you have keratoconus, keratoconus means cone-shaped cornea. Keratoconus means cone-shaped cornea, which is a disease we are going to discuss in our next or next to next class. Cone-shaped cornea. So keratoconus is the cone-shaped cornea, and it is also the indication for penetrating keratoplasty, or failed previous graft can also lead to the uh, penetrating keratoplasty. Now, what are the contraindications? Okay, contraindications include active infection in the eye or uncontrolled glaucoma. Okay, active infection in the eye, uncontrolled glaucoma. So if there's an active infection, you cannot take out the cornea. Otherwise, the cornea can also become infected, and there will be no use of this cornea that has been harvested. Okay. If there's uncontrolled glaucoma, so uncontrolled glaucoma means the IOP or the intraocular pressure is very high. And if the intraocular pressure is very high, you take out the cornea. Okay, you take out the cornea. So what will happen? The intraocular pressure will suddenly be very decreased, and you can permanently lose your vision. Okay, so that's why in uncontrolled glaucoma, it is not advised to do the keratoplasty. Okay, now eye bank I have mentioned the next slide. So eye bank, what is an eye bank? An eye bank is a facility. Okay, I'll underline the main points. An eye bank is a facility that recovers, processes, stores, and distributes donated eye tissues, primarily the cornea, for transplant and research. Okay, so what is happening over here? We are taking out the cornea. Okay, sorry, if keratoplasty is done, okay, so the cornea has been taken out. So what we are doing, we are taking out the cornea and we are just recovering it, we are processing it, we are storing it, and we're distributing it to the needful person. Okay, and it can also be used for the research purpose. Okay, either it can be used for the research purpose or it can be used for the corneal transplant surgeries. Okay, so that's the function of the eye bank. So it plays a crucial role in addressing the corneal blindness. Okay, so if there's a corneal blindness, you can just contact the eye bank and ask whether they have the cornea or not. If they have, they will provide you with the cornea, and by that you can treat your corneal blindness. Okay, by ensuring a reliable supply of corneal tissue for keratoplasty, corneal transplants. Okay, keratoplasty is corneal transplants. So eye banks follow strict protocols for donor screening, tissue preservation, and quality control to ensure safe and effective grafts. So just like the blood bank, an eye bank also functions the same way. It just functions for the cornea. Okay, especially it is done for the cornea. Other eye tissues also, but mainly it is done for the cornea. Okay, so they also work to raise awareness about the eye donation. Okay, they raise awareness about the eye donation and educate the public on the importance of corneal transplants in restoring the vision. Okay, so that is a function of the eye bank. Okay, so this is the one short note of the eye bank. You can write at least 6 to 7 points from this paragraph. Okay, now next topic is layers of the cornea. So what are the layers of the cornea? So we have 5 layers of the cornea. First is the epithelium. You can see in the diagram. First is the epithelium. Okay, this is the epithelium. Then it's Bowman's membrane. Then this is the stroma. Okay, this is the stroma, the big one, the light blue one. This is the stroma. Then you have Descemet's membrane. You have Descemet's membrane, and then at last we have endothelium. So these are the 5 layers of the cornea. Okay, I'll mark it 1, 2, 3, 4, and 5. These are 5 layers. Just remember these layers: epithelium, Bowman's layer, stroma, Descemet's membrane, and endothelium. Okay, and what are the functions of these layers of cornea? So the epithelium functions by protection and regeneration. Okay, it protects and regenerates the epithelium of the cornea, and stroma is for transparency and refraction. Okay, stroma is for transparency and refraction, through which it helps the light to pass to the lens, pass through the cornea. It helps the light to pass through the cornea and transfer it to the lens. Okay, and it is also responsible for transparency of the cornea. Okay, so we have epithelium and we have Bowman's layer. We have stroma, we have Descemet's membrane, and we have endothelium. Now the corneal scars. Okay, so what are the corneal scars and what are the corneal scars? Means the scars present in the cornea. It's as simple as that. Okay. Now what are the causes for corneal scars? So it includes previous infections like corneal ulcers. It includes the trauma or surgery. Okay, if there is a trauma or surgery, that means your cornea has been inflamed, and due to the inflammatory reaction, uh, it left behind it is left behind the corneal scar, or if you have any previous infections in the cornea like corneal ulcers, then also it can develop into the corneal scar, and it can lead to the reduced visual acuity, glare, or astigmatism. Okay, these are the effects in the vision. And how do you manage this? These can be managed by optical correction like glasses or contact lenses, or you can surgically you can do keratoplasty if visually significant impaired, right? Okay. So the causes includes previous infections, trauma, or surgery. Okay. Effects on the vision, it can lead to the reduced visual acuity, glare, or astigmatism. Okay. Reduced visual acuity means that you are not able to see things very clearly, or you are having very glare, like everything in front of you appears very black, and suddenly your vision reappears, and then again everything appears black, and you can also develop astigmatism. Okay. So that is the effect on the vision. And management, it's by glasses, by contact lenses, and by keratoplasty. So that is the corneal scars. Now, what is exposure keratitis? Exposure keratitis means inflammation of the cornea due to exposure of anything. Now, what exposure that we'll see? So the causes includes a lag of ophthalmos, incomplete eyelid closure, and facial nerve palsy. Lag of ophthalmos, incomplete eyelid closure. If you're not able to close your eyes properly, even if you're sleeping, for example, even if you're sleeping and your eyes is still 1/10 open. Okay, so what will happen? Dust particles, bacteria, everything that will come into your eyes. Okay, and that can lead to the keratitis, like inflammation of the cornea. So that is known as exposure keratitis. And you can also have a facial nerve palsy. In facial nerve palsy, also you're unable to open, you're unable to close your eyes. Okay, you're unable to close your eyes in facial nerve palsy because the seventh nerve is responsible for your ocular muscles movement. Okay, so. Um, Lack of thymus and facial nerve palsy are the two causes that can lead to the exposure keratitis. And if your eye is exposed for a long period of time, that means you will have dryness of your eyes, you will have corneal epithelial defects, and you can also have redness of the eyes. Okay, so these are the three clinical features that you can see in the patients of exposure keratitis. Now, the treatment includes lubricating eye drops and ointments. Okay, you have to give lubricating eye drops because your eyes are becoming dry day by day, and you have to give ointments to reduce the bacterial inflammation. You can do taping eyelids closed at night. So you can just tape your two eyelids. You can just tape your two eyelids so that your eyes remain closed at night. Okay. Surgical option is tarsorrhaphy. So tarsorrhaphy is partial closure of eyelids. So it is surgery to close your eyelids for severe cases. Okay, so tarsorrhaphy is a very important surgery. Just remember the name. You don't have to remember the procedure. Just remember the name that tarsorrhaphy is done for exposure keratitis. Okay. Now, what is Murine ulcer? So Murine ulcer is also a very important topic that happens to be in your syllabus. So the definition, it is a chronic peripheral ulcerative keratitis of unclear causes. So the every line of this definition, it is only 6 to 7 words, but every word is very, very, very important. Okay. So just remember this. This is a chronic, this is a peripheral, this is the ulcerative keratitis of unclear causes. So we don't know the causes, but there is chronic, but there's peripheral, then there's ulcerative keratitis. You can see in the diagram, there's a peripheral corneal ulcer keratitis. Okay, in the periphery, okay, of the cornea, there is a keratitis. Okay, so in the periphery, it is present. In the periphery of the cornea, it is present. Okay. Now, what are the clinical features of Murine's ulcer? You can experience pain, redness, and tearing. That is the clinical features for almost every topic that we are seeing nowadays, because in anything, if there's any disease or if there's any uh, complications that is happening to your eyes, okay, that will lead to the pain, redness, and tearing. Okay, because in response to the inflammation, or in response to the uh, this disease, that will create excessive tearing, or that will result in excessive tear production. Okay, and redness is due to the inflammation, and pain is also due to the inflammation. Okay, now the next clinical feature is the progressive peripheral corneal ulceration, because there is increased keratitis that will lead to the formation of the corneal ulcers. Okay, and it is peripheral. And what is the cause of this Morine's ulcer? That's unclear cause. Okay, so you can just read it here also. Morine's ulcer is characterized by progressive precentric peripheral corneal ulceration that is slightly central to the corneoscleral limbus. Yes, this slightly central to the corneal scleral limbus. I will tell you that later on. So management, it includes medical and surgical management. So medical management includes topical steroids and immunosuppressive agents. Okay, the medical management includes topical steroids and immunosuppressive agents, and surgical management includes conjunctival resection and amniotic membrane grafting or corneal transplant if unresponsive. Okay, amniotic membrane grafting can also be done in place of cornea. They can be conjunctival resection. You are removing the conjunctiva, a part of conjunctiva in which the cornea is inflamed, and you can also give corneal transplant if unresponsive. Okay, so first you have to give topical steroids or immunosuppressive agents topically. Okay, if it is not responding, then you have to surgically intervene. Okay, so this was about the Morine's ulcer, and that is our end of the class today. So we have discussed very important topics like fungal keratitis, like hypopine corneal ulcer, layers of cornea. Okay, and corneal scars and eye banks and interstitial keratitis. So these are topics that has been repeatedly asked in our exams, and I have tried to make it to you, and I have tried to deliver it to you very simply, such that you remember the topics for a long period of time, and it is easier for you to make notes, because if you remember the points, you can write 1 to 2 line about that point in detail. Okay, you don't have to write your answers in point in the exams also. You have to write point in point wise manner, but you have to frame sentences. You can't just write the pain, redness, and tearing. Okay, you have to write there is a pain in the cornea, there is redness of the cornea due to the inflammation, there is excessive tear production which leads to the tearing of the eyes. Okay, so in that way you have to frame your answers. Okay, so that will help you gain more marks, because it will look the answer well written, and it will look lengthy also. So the examiner will know that you have studied it properly. Okay, so this was the end of the today's lecture, and we'll meet again next time soon. Thank you so much. Hello. 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 Hello.
Hello, sir.
Yes, I'm done. The
Oh,
class. Okay, thank
okay,
you.
sir. Thank you.